Welcome to this podcast from the Medical Journal of Australia. My name is Sally Block, the MJA's news and online editor. The MJA acknowledges the traditional owners and custodians of the land on which we live and work across Australia. This podcast was recorded on the lands of the Wangal people. I pay my respects to their elders past and present. This year marks the 90th anniversary of Australia's National Health and Medical Research Council. From its official inception in the 1930s, the NHMRC has had a rich history from protecting Australia from diseases like polio and tuberculosis to making sure it backs high-quality research that is ethical, rigorous and focused on community benefit. The Council Chair of the NHMRC, Professor Caroline Homer AO, joins me now. It's the 90th anniversary of the NHMRC. Tell us about its beginnings back in the 1920s.
So the beginnings, I think, are actually really interesting. The NHMRC began in the 1920s when Australia recognised that health challenges couldn't be tackled state by state alone. So, the history is from a federation perspective. So in 1926, the Federal Health Council was created to bring the Commonwealth and the states together around public policy. And the first meeting was held in Melbourne in January 2027. Chaired by the illustriously named Dr. John Howard Liggett Cumpston. And this was the first kind of setting the tone for a national approach. So NHMRC was formally established, though, in 1936. And by then, the foundations were really being laid for a system built on shared expertise, evidence and collaboration, particularly across the states and territories and the Commonwealth.
So by the 1930s, the foundations were laid following on from the FHC to establish the NHMRC. What was its role by this stage?
So NHMRC, as you say, was established in September 1936, and it was the successor to the Federal Health Council. So it inherited this national coordination role, but started to develop this strong emphasis on research, which I guess is probably what it's known for now. But back then, its early purpose was to advise the Commonwealth and state governments on health matters, including legislation, administration and expenditure. So it's always been more than just a grants body. And right from the beginning was at this intersection of policy, standards and research. NHMRC for the first time brought these previously separate functions together in a national organisation, and key role was funding research, as it still is. Other key role was developing advice, and that's our guidelines that are a really important part of NHMRC, and then promoting this coordinated approach to health. So that was in 1936. By 1937, the new council allocated £30,000 in research grants at its first meeting. And this is sort of the beginnings of moving from just being advisory into really providing research support and funding.
What is the NHMRC's role and governance?
So NHMRC's role is probably broader than many people realise. I think for me as a researcher, I always thought it was just about funding health and medical research. But NHMRC develops evidence-based advice, supports third-party providers to develop evidence-based advice, that's what we call the guidelines, and helps shape national health standards. And a really important piece is a central role in research ethics. So we have an act, the NHMRC Act 1992, that makes it really clear that the job of NHMRC is to improve health standards for people in Australia and beyond, to improve research and training, promote consistency across Australia, and this really important piece about ethical consideration in health, which is where the ethical guidelines come into place. At a governance level, NHMRC is led by a CEO who reports to the Minister of Health, and the CEO is supported by structures including the NHMRC Council, which I currently chair, and principal committees, Research Committee and the Australian Health Ethics Committee. In recent years, we've actually developed other committees which now are shared with the MRFF. So it's a very clear governance structure with very good advice coming through to the CEO.
You mentioned the first round of health and medical research grants were allocated back in 1937. What were they for?
It's so interesting looking at what was funded back then. So 1937, these grants started in 1938. Infectious diseases, physiology, public health, and maternal child health were the four key areas. And this was the first time there'd been a national coordinated approach to funding medical research in Australia. So at that first round of meetings, the £30,000 was a pretty bold investment for the time. I'm not sure what it would be worth in current terms, but at the time it was a significant investment and a real statement that Australia wanted to build a national medical research capacity. And these were the issues of the time: infectious diseases, physiology, working out why things worked the way they worked, the public health, and of course maternal and child health. So the focus was both on scientific, understanding the basic science, and also on implementation. How do we make things better? So this research support, it helped institutions and researchers, so universities at that time and researchers, build momentum, and including many who go on to have global impact. A really important example of NHMRC funding during those years is the research produced out of WEHI. A standout example of NHMRC funding during those early years is the research produced out of WEHI by Sir Macfarlane Burnet and colleagues, and I'm sitting in the Burnet Institute at the moment named after him, so it feels like a very important touch point. Macfarlane Burnet made really important advances in influenza virology through the 1930s to the 1960s through a succession of grants funded by NHMRC. That work included cultivating influenza virus in embryonic eggs, characterising antigenetic variation, and developing laboratory assays that transformed our understanding about how influenza viruses evolve and spread. And of course, this is a technique that's been adopted globally, refined over time, and we use it to this day. And it's now still influencing flu vaccines that we are having at this very moment.
World War II affected research appropriations. In 1946, the Expert Committee on Rubella in Pregnancy was established. What was its role?
Yeah, so rubella in pregnancy obviously is a very important infection and creates, if a woman develops rubella in pregnancy, there's considerable impacts on the unborn baby, and then when the baby's born. So it's still a really important problem today, and every woman in Australia is vaccinated before she falls pregnant for rubella, and every antenatal clinic around the country still tests for rubella when women present for their first antenatal visit. So it's super important. But it's really interesting that back in the 1940s, an early rubella epidemic, a man called Dr. Norman Gregg observed this infection causing serious congenital harm. So what we now do comes from the research that happened in the 1940s. And NHMRC responded at the time in a way like they respond now on things that are current. So from 1946 to 1950, there was an expert committee chaired by Sir Frank Macfarlane Burnet, and this looked at the evidence, coordinated national thinking, and alerted clinicians. And so this is not an academic exercise. It was an example of NHMRC turning emerging science into public health understanding and into guidelines that, as I said earlier, we use today. So this is a really great example of an NHMRC impact case study.
Now, after the end of the war, training fellowships were established. How did this begin?
Yeah, so in 1946, very soon after the end of the war, NHMRC awarded the first structural training support through public health travelling training fellowships. This backed overseas training for Australian public health doctors and started strengthening national capability. But it was an early sign that NHMRC wasn't only interested in funding projects, but also in building the workforce. because the workforce is the critical element to deliver future discoveries and health impact. So NHMRC fellowships, now called investigator grants, have been around for a very long time.
The 1950s was an era of scaling up. How did that set the stage for the future?
So, the 1950s, I guess, in many parts of Australia was a sort of a scaling up era. For NHMRC, it was no longer about foundations. It was really about beginning to operate at scale. So in these years, NHMRC expanded from supporting research to help shape national responses to major health issues. Again, infectious diseases, maternal child health, public health standards. And I guess what really matters about this decade is that it set a pattern that NHMRC still follows today, which is to fund excellent research, to bring experts together, and to turn evidence into policy and practice. And I guess the 1950s was the time that NHMRC was really transformed from this emerging kind of council into this national system builder and supporting many of the activities that we now see today.
There's two significant things during that era as well is tuberculosis control and the polio vaccine. How was the NHMRC involved in these issues?
Yeah, so tuberculosis is a really good example of how an agency like NHMRC can work at its best, bringing together data, research, and the national coordination. And at the beginning of the 20th century, TB was one of the leading causes of death in Australia, so a really big public health challenge. In 1937, NHMRC established a standing committee on tuberculosis, and that began the first nationally coordinated effort to map infectious rates across the country. It funded early TB research, and by 1945, one NHMRC funded scientist, Dr. Nancy Atkinson, produced the first Australian-made vaccine. So this research, the evidence, the future advice really helped underpin the national TB campaign after the war, and leads us to be in a position now where TB as an Australian issue is no longer in our country, although we do still see a lot of tuberculosis, particularly for migrants coming from other countries. So it's still a really important issue, and amazing to think that we've been working on TB for so many years, and it's still an issue. So I guess the important story about TB is that it wasn't just a single breakthrough. It was multiple things over time. And it's not only just the research. Of course, the research is important, but it's the coordination, the guidelines, and then the policy foundation. So I think if we think about TB as a really great example of the impact of NHMRC, and there's an impact case study available on the NHMRC website that you can read. But it still shows us there's still a lot to do. You know, TB is still one of the leading killers in our region. So we still need to harness that research. We still need to harness that policy implications to learn in other countries as well.
How was the NHMRC involved in that very successful vaccination for polio in Australia?
Yeah, so in the 1940s, 1950s, polio was one of the most feared diseases of the era, especially for children. And I'm sure we've all seen photos of polio epidemics, of iron lungs in that time. And from 1944 to 1954, so a 10-year period, it caused more than 1,000 deaths in Australia and left many with those lifelong disabilities that we've seen in old pictures. So NHMRC made a huge contribution to the 1956 polio vaccine rollout and really helped create the conditions for success. The vaccine was developed overseas, but in Australia it was mass-produced from about 1956 and then delivered through these major public immunisation campaigns that I'm sure many people listening can remember. So NHMRC played the systems role, supporting the research environment, bringing people together, and then helping build confidence in evidence-based public health action. And this is another lovely example of public health action, but also health systems research. Actually, how do you get this polio vaccine into where it needs to be delivered? And a nice Australian link in that story is Dr. Val Basley, who worked with Jonas Salk and then returned to Australia to help pioneer vaccine production at CSL. So that research made a huge difference to us in Australia, and then we were able to implement it for the whole community.
So from this time onwards, there have been many firsts for the NHMRC. What are the most important from your perspective?
Yeah, it's a really good question. I think for me, it's about things that change the system, things that go on for time, not just a one-off. So I think the ethics guidance on human experimentation was really important. And these guidelines are updated in living time. We don't wait for 5 years to update the whole thing. They're constantly being worked on. And this is really critical. There won't be a researcher in Australia, I hope, that doesn't know about these ethics guidelines. So they're NHMRC developed and owned, and just so important. At a public health level, the Australian Drinking Water Guidelines are another standout. At the time, they were a real turning point in research being translated into something that protects people every day and that actually has an impact on everybody all of the time. So that, again, has been recently updated and another sort of a living document. Research integrity is super important, particularly to ensure that the research is of high quality and can be trusted. So we have a research integrity framework that NHMRC has developed, and that's now used by researchers, again, every day. And one of the most important and exciting shifts in recent years has been NHMRC's Gender Equity Initiative. And I was really lucky to be the first chair of the Women in Health Science Working Committee more than 10 years ago. And then we worked through that committee, with NHMRC and a broader consultation to develop a gender equity strategy, and then lots of practical interventions in the grant program to ensure that we're able to address these systemic disadvantage for women and non-binary applications, particularly in investigator grants. This has really changed the landscape of how gender equity is thought about in investigator grants, and we are a world leader in this space. This was a very brave initiative done in 2023 and is now really showing benefits, I think, for female applicants and gender diverse people. So my examples, I think, hopefully show that it's about system change. It's not about a one-off, and that research needs to be translated into practice and then translated into policy. And that's when you see the biggest impact.
What's the significance of the NHMRC Act being enacted in 1992?
So I suspect many researchers don't know about the NHMRC Act. I encourage you to go and have a look at the Act. It's obviously publicly available. This was really important because it put NHMRC on a clear legislative footing. The Act spells out the purpose, which is, as I said, to improve health standards, support research and training, foster national consistency, and promote ethical considerations in health. And the Act is the document that really shows that NHMRC's role is broader than just funding grants. The Act also established these governance arrangements that I mentioned before, the NHMRC Council, the principal committees, the Australian Health Ethics Committee and the Research Committee, so that expert advice could be built into the system in a really stable and transparent way. So in that sense, the Act really helped turn NHMRC from an important institution that the country valued, but into a clearly defined national authority. And we see that used now in many health issues that come to pass. COVID-19 is just one example.
So what is the value of integrity, collaboration, and long-term impact over short-term outcomes?
So integrity, collaboration, and long-term impact are really what good research is and what good research does. integrity matters, because if the evidence isn't rigorous and trustworthy, then the whole system falls down. And we've seen this really importantly over recent years around the lack of public confidence in some research. And so we really need to make sure that the public can be confident in the quality of the research, and that's where integrity comes into place. Collaboration matters because all big health challenges can't be addressed by one discipline, one institution, one state or territory. And we all have to come together to solve complicated problems. So the most important advances in health and medical research are never quick wins. They're over time, they're collaborative, they bring people together. And so I think those three key issues, integrity, collaboration, and long-term impact, really show that you need those as the foundations to come back to later.
So this feeds into the next question, is what is the role of the NHMRC in maintaining public trust by ensuring research is ethical, rigorous, and focused on community benefit?
So public trust is fundamental. And as I've said earlier, mistrust in research is a very unhelpful strategy going forward. So trust gives us, as health and medical researchers and health and medical research, its social license. And NHMRC builds on that by not just funding research. It helps set it does set the national framework for ethics, integrity, and responsible conduct. And that matters because the public needs the confidence that research is rigorous, that participants are protected, and that their work is focused on community benefit. So these are really important aspects of NHMRC, maintaining and building trust, supporting excellent research, and shaping those standards and safeguards that make the science worthy of public confidence.
How do you highlight real-world outcomes for individuals, communities, and populations?
So NHMRC has published over 60 impact case studies. These are available on the website, and they're just fantastic, providing really detailed evidence of how the research that NHMRC has funded has led to real improvements in health and Australia's health services, but also beyond Australia. So when I think about highlighting to people I meet around what does NHMRC do, I try and think of the things that people know. So when we all turn a certain age, we get a bowel screening kit in the mail. That's because we've done research. NHMRC has funded research showing that makes a difference to detection of bowel cancer and long-term outcomes. The HPV vaccine that all of our children now are offered through the immunisation program when they're at school, that's a critically important intervention. Australia will be the first country to have zero cervical cancer in the next few years. And that's because the research that was done and funded and supported, but importantly, the guidelines that came from that. The evidence-based dietary advice that we now give with confidence all come back to the research, the evidence, and the policy work that made it possible. So there's actually so many fantastic real-life examples of where NHMRC has led research, led guidelines, and now we're seeing really great impact in everyday life for all of us. And I think some of the most important outcomes are things Australians now really take for granted because they work. So the bowel screening kit, vaccination, healthy eating guides, healthy drinking guides. I mean, these are the things that we live with every day. And it's really the story of translation from discovery to evidence to guidelines and hopefully to healthier individuals, communities and populations. And not only in Australia, but in other countries too, especially in our near neighbours.
And what is the reality when it comes to failure in research?
Failure is always a hard thing to talk about. It's a hard word, but failure is part of good research. And if all of our experiments or all of our studies were successful, then we're probably not asking hard enough questions because some things won't work and some hypotheses weren't right. So long as the research is done with integrity, with quality, with ethics, failure is actually really important, because that's the way to test new ideas. That's the way to work out what is going to work. Some of the most useful research outcomes are the things that say it doesn't work or give us unexpected results, because they then help define new methods, rule out dead ends and stop wasting time on things that aren't going to work, and help us think about a better direction. So failure is not a problem. The problem is if we fail because of poor rigour. Our studies were designed poorly or done unethically. That's the problem of failure. Or we don't report failure. So poor reporting is a real problem. So I think we shouldn't worry about avoiding failure, but we have to have a culture that values honesty, learning, transparency, and continuous improvement.
And following on from that, how do you normalise rejection, near misses, and stalled ideas?
Oh, well, as a researcher, I've had lots of those over my time. Mostly with rejection, you take a big breath and you don't react straight away. Go for a walk, go and have a cup of tea. Think about usually rejection. In rejection, you come up with good ideas for the future and good feedback. So the reality is these things are normal. We're in a highly competitive funding environment. Many, many excellent ideas, many excellent research grants don't get supported. And that doesn't mean they're not good research ideas. We just don't have enough funding to fund all the good ideas. So I guess a near miss, and there's lots of definitions of what that is, but it's part of the pathway. So a near miss helps us think about, is that the right question? Is that the right design? Maybe we haven't got exactly the right people in the team. Maybe we should do things a little bit differently. And there are some ideas that are just ahead of their time. So for me, I think it's always about, if you're a researcher and you work in this space, you have to be resilient. You have to adapt and you have to learn. And that's hard for many people, particularly in a tight funding environment. But so for me, it's about normalizing and creating a culture where we all understand that resilience, adaptation, and learning are part of the research process. And not being funded is not evidence that you've failed. It's part of the process that we have to work out how to come through in a resilient way. So we have to recover, we have to adapt, and we have to rise again with purpose and resilience.
And how do you position Australian researchers as leaders?
So I think Australian researchers are leaders. We certainly punch well above our weight on many metrics around publications and around the research that we do. But it's really important that we lead in terms of creating the conditions for health and medical research excellence over time. So that means we have access to competitive funding, to fellowships, to training pathways, that we're committed to strong ethics and integrity frameworks, and we have collaborations across disciplines, nationally and internationally. So NHMRC plays a huge role in that. It builds capability, capacity, credibility. And our leadership in the world includes discovery and includes translation. So we're part of a global landscape around getting evidence into practice. So developing the evidence, finding the answers, and then getting it into practice. And we're doing this in many countries around the world. So our work is changing policy, it is changing clinical practice, and it is changing health outcomes, both here and globally.
And lastly, with the future of the NHMRC, what comes next?
Yeah, I think the purpose of NHMRC is correct, and the core purpose and holding the line on particularly integrity and ethics is so important. We're in a very complicated health landscape, but I think keeping an eye on the important things around integrity and ethics will serve us very well. it's an interesting time in the world, many big challenges ahead. We have emerging infections, we have the impact of climate and environmental health, we have opportunities for new technologies, we have AI. We also really have issues around chronic health, mental health, and all the social determinants of health, of course. And we have a health system that is really important, that research happens on the health system as well. How do we make the best health system we have? So all of those issues and many more need strong research, and they need then translation into policy and practice. And while we do that, we have this continued focus on integrity, ethics, collaboration for long-term impact. So NHMRC's role is about having this research system that's inclusive, resilient, and ready for the future. And it's very exciting that the new National Health and Medical Research Strategy was released in May this year. And this is so important. It really signals what we need in terms of coordination and long-term direction for the future. So it's at a pivotal point to have that strategy released to really make a difference. And practically, I guess that the anniversary program, so this point in time, really helps us think about the future and think about the storytelling we must make happen, focused on this impact, on engagement, and on translation. And of course, this anniversary won't be the last, and there'll be more celebrations to come.
Thank you to my special guest, Professor Caroline Homer, AO. You can find more podcasts on our website at mja.com.au or wherever you find your podcasts. Thank you so much for listening.